Dr. Anthony Fauci said that this confusion is coming from the new mask guidelines by the CDC. Today, he actually acknowledged that there's going to be confusion between businesses figuring out if they can let people without a mask inside. So my question is, how are you looking at these guidelines? And is it too early, Dr. Parikh, for these guidelines to be, used here?
Yeah, so, I think the guidelines are a good step in the right direction. I hope it motivates people to get vaccinated. But in some ways, I do worry that it might be a little too early, only because we only have about 37% of all Americans fully vaccinated. Right. And in the New York, New Jersey area, it's about 42%, right? So that means majority of people still are not fully vaccinated. So it can be very confusing. And especially if we have no way of checking when you walk into any public business or establishment who's vaccinated, who's not. So I'm actually advising my high-risk patients, like people with breathing problems, immune problems, to keep masking, especially if they're in public areas and especially indoors, right? Because until we have more of the population fully vaccinated, I think that's where the confusion still lies. And a lot of places you still do have to wear a mask, even per the CDC guidelines. So that includes all public transportation, planes, trains, buses, homeless shelters, nursing homes, healthcare facilities. So a lot of places where I'm in, it hasn't really changed much. And since my patients are high risk, I haven't really changed my behavior that much, to be honest.
So let me ask you a question. South Asians that are at high risk as well, doctor, who have diabetes, heart diseases, liver diseases, lung diseases, same recommendation for them, wear a mask whenever you can?
Yes, especially South Asians, because exactly what you said, they have all of the high risk conditions for severe COVID-19, including, heart disease, obesity, all of the things that you mentioned, diabetes. So if they're in public places, I would still encourage, and they're high risk, I would still encourage them to wear masks. If they're within their own home with all fully vaccinated people, obviously that's a safe environment. If they're outdoors, the risk is low. But again, the catch is if you're outdoors and not in a big crowd, right? Because in a big crowd, you have no idea who's vaccinated, who's not. And the key difference, I think everyone forgets, even if you're fully vaccinated, if you're showing symptoms, you could still be sick or make somebody else sick too. So that's another important thing to note, So this is like a relaxing of guidelines, but people have to still be careful, in my opinion.
Right. And meanwhile, Doctor, New York, where we are, New Jersey, our neighboring state, are doing these massive reopenings starting tomorrow. Restaurants can work at full capacity. Broadway's opening up. There's a lot of openings happening. Is it again too early for New York, which was the epicenter, Jersey, who also got so affected because of New York as an epicenter, to open up to this extent?
Yeah, I think the reopenings are good. We're moving in the right direction. But again, we have to be adaptable, right? So we have to be careful and be prepared that if those cases go up, we might have to start closing some things down again, too. So again, yes, it's a glimmer of hope, but we do have to be careful because, like you said, we were the epicenter. Also in New Jersey, we already have some of the variants, like from India, where we know the vaccines may not be as efficacious. So again, for all of those reasons, while it's great we're reopening, I hope it's done safely. And as they always say, the devil is in the details. How are you going to monitor who comes in and out of these establishments to make sure that they're fully vaccinated and abiding truthfully by guidelines?
Right. Doctor, there is right now a decrease, thankfully, in cases across the country. Yesterday, 15 states reported no deaths, which is obviously a good thing to hear. When you're seeing these restrictions be loosened, CDC relaxing things on the mask, could this affect this decline in cases? Are you worried about that?
Well, hopefully we want to see a decline, and we expect the decline to continue as long as the vaccination increases. So this is all expected and all good news. It's great to hear that 15 states and no deaths. So hopefully, in order for us to continue that decline, even as we take our masks off, even as we reopen, that means it's up to everybody, if you're not vaccinated, to go get your vaccine, and that includes now age 12 and up, because they're very much part of the whole herd immunity puzzle.
Right. And just talking about the age 12 to 15 years old, this is a huge news with them being able to get the vaccine, but parents are still hesitant. They believe the children are still developing and they're not sure what that could impact on them. So what do you have to say to that?
Right. I would tell parents that, they should be far more worried about the real virus than the vaccine. 1 in 5 COVID infections are in children. We're still seeing children in the ICU very sick. I know children as recently as, in the last week or two who've been admitted. So it's not that kids are immune, and we and the FDA never approves anything in kids unless they're absolutely sure that it's very, very safe. Like the standards are even stricter than they are for adults. So parents should rest assured that, all the safety checks and balances have been followed, and they're actually protecting their children more by getting them vaccinated, especially as things reopen and we go back to school soon and all of those things.
So that was my million-dollar question I was about to ask you. Do you think schools can open up safely in the fall if, say, most of the children are vaccinated?
Yes, I think schools actually can reopen safely because schools haven't been areas of large outbreaks, really. And unfortunately, for children, their learning really relies on in-person learning. They miss out a lot when they're learning remotely. So for their intellectual development, emotional development, they do need to be in school. And unfortunately, they've been punished for a lot of the adult mishaps and mistakes in the pandemic. So I do think children should return to school as soon as possible, and the vaccine will help them do so. Now, it's a little bit different for colleges and universities. There we have seen outbreaks because there's more social setting. People are living in very close quarters. But, for elementary school, high school, if there's vaccine available, it's even more reason we need to reopen the schools for the children.
Doctor, last year, the summer, when we got to the summer, things became better, stuff started opening up, cases were going down. And then when fall came, we saw an increase in cases. My question to you is, could the same trend happen this year?
It's very possible. In summer, people are outdoors more, which is lower risk. They're not inside congregating as much. So we could see a drop in summer. And even Dr. Fauci has said this, that we might have to wear masks seasonally in the winter and fall months forever, because not only with coronavirus, but we saw virtually no flu this year, which is huge because flu takes millions of lives, even children's lives yearly. So we may be wearing masks similar to many of our, friends in Asia for oncoming years, especially in the winter months.
Right. So what's your prediction right now for the next month or so?
So I think hopefully in the next month or so, I hope cases continue to decline. As the weather gets warmer, people are spending less time indoors. But I hope they also continue to decline because people who didn't get the vaccine get it. I hope, children get the vaccine. And then I think as those things decline, we'll also have better news with variants too, because the more people who are vaccinated and they're less cases there are, then there's less likely we'll have new variants too that we need to worry about. So I'm hoping things continue to move in the right direction, but I'm optimistic that we'll do so.
Yeah. For my last question, I'd like to discuss with you India and its ongoing devastation. You're Indian, I'm Indian. We came to do a lot of South Asian diaspora, so everyone's really worried about what's happening there. How are you observing it? And do you believe India opened up way too fast and this is the result of that?
Yes, what's happening in India is quite tragic and heartbreaking. And I think a lot of it has to do with the relaxation of rules too quickly. So if anything, India should be the perfect example about why we still need to be careful and why we need the vaccine, because they are very behind on their vaccination. I think they have less than 10% of the whole country vaccinated. I don't know the most recent percentage. And then on top of that, things did open too quickly in terms of, political rallies, religious events. Those things probably could have waited. I understand the need to reopen for people that have to work because so many people are reliant on their jobs and going to work. That's a different story than opening, having very large events that aren't necessarily essential. So I think that was part of the problem, unfortunately. And now, it's gotten to the point where their healthcare system is overwhelmed. Luckily, it seems in the last few days they are seeing a little bit relief, but they still have so many cases and the variants there. We know already some of our vaccines aren't working as well against them because there are U.S. travelers who've fallen ill there despite being fully vaccinated.
Right. Just a follow-up question. When do you see India get out of this?
So I'm hoping, in the next few weeks, that the key is that they need to be able to increase their vaccination rates, get people away or out of the hospital, just so there's enough resources. It's always a race against time. I mean, we saw that in New York early on in March and April, when we were having thousands of cases daily, hundreds of deaths, because we had the cases were outnumbering our resources. So basically, India has to do the same thing, where have the resources outnumber the amount of cases. I'm hoping in the next few weeks, as other parts of the world, including the U.S., send aid. I know the U.S. has already planned to send more vaccination doses and PPE and oxygen, but I'm hoping that it's enough, because as we know, it's the most densely populated country.
Yeah, truly a tragic story what's happening in India right now. Thank you so much for your time on ITV Gold, Dr. Parikh.